Welcome back to Morning Express. It's time now to delve into more conversations, particularly in commemoration with the World Hepatitis Day. Every year, on the 28th of July, the day is commemorated as the World Hepatitis Day to raise awareness about a group of infectious diseases. Over 7 types of hepatitis. I bet you didn't know that. But if you do, it's important to have this conversation on the theme for this year's celebration. The theme for the 2025 World Hepatitis Day is Let's Break It Down. And that's what we intend to do as we join our next guest virtually. We're being joined by Odhiameh Alle, who will join us to discuss hepatitis and you. Hello, good morning to you, Odhiameh, and welcome to the program. Hello, can you hear me?
Good morning. Can you hear me?
I can hear you now.
Good morning.
Welcome. Let us begin on a light note. Happy New Month to you. Welcome to the month of August.
Thank you very much. Yeah.
You're welcome. Now let's get into the conversation. Hepatitis and you. The theme for this year is Let's Break It Down. Let's begin with the basics. What's to know about this disease called hepatitis?
Okay. I think, like you said, hepatitis is a disease that has different types, and the fact that it is a viral infection, and it affects basically the liver. So that's why it is definitely important to make sure that we do all we can to not get it. And there are different ways in which it can be gotten, and it's actually dependent on the type you get. So you can be getting from person to person contact. That's from someone who already has it. It can also be gotten from the fecal oral routes too. That's either through ingestion of food or water. That's referring to hepatitis A now. And if we now move on to, let's say, hepatitis B too, that one can be gotten through body and blood fluids, just by sharing needles, unprotected sex, unsafe blood transfusions. Can even be transferred from mother to child at birth. Even things like poor infection control at hospitals, are ways in which this hepatitis B can be gotten. Then if we go to C2, that is the hepatitis C virus called HCV. HCV. That one is also can also be gotten through blood transfusions, unsafe injections, shared needles, unsterilized medical equipment. That's why this year's team is very important, breaking it down so that people know these things, because knowledge, like they say, is power. So if people know how it is being spread, then they can also prevent themselves from getting it.
Now, averagely, there are some notions that are on the streets. You'd hear people talk about alcoholic hepatitis. People believe that the consumption of alcohol in some
Yeah.
way, are these notions correct?
Well, yeah, because a lot of times the thing is that alcohol abuse is one of those things that can lead us to some diseases that can come as a result of the lifestyles that we live. So things like alcohol abuse, things that can basically sedentary lifestyle and all of this. There are factors that can lead to some of these non communicable diseases, like NCDs we call them. So at the end of the day, it's not like alcohol is the
Well, it may seem as though Odhiameh's network is giving him some of the challenges with weakness with our previous guest this morning. But just in case you're just joining us, it's a conversation we're having about hepatitis and you, particularly off the back of the commemoration of the World Hepatitis Day, like I said earlier. He was breaking it down, things to note, that it is a viral disease. And viral diseases quite seriously have implications on your health. Most of them you could get through contact. It was talking about the types of hepatitis A, B, C, D, and E. And whilst it is one that affects your autoimmune system, there's also the possibility for you to prevent yourself from contacting hepatitis. And now we have him back on the show, and I would like for him to pick up from where he left off. We're talking about alcoholic hepatitis, and you were explaining how alcohol abuse can put you at a risk of contracting that. Pick up from where you left off, please.
Okay, yeah. Can you hear me?
Loud and clear. Carry on.
Okay, so yeah, I was saying that alcohol abuse is one of those things that can actually predispose us to things like hepatitis. You get so because it is not like alcohol abuse causes hepatitis, but those things that can put us at risk. So it is important that when taking alcohol, take it in moderation. Basically, everything should be done in moderation, but alcohol abuse puts us at a higher risk of all NCDs, of which hepatitis is one of them. So we need to be very very careful about how we take alcohol, and not just alcohol alone. Like I said, sedentary lifestyle, not moving around. A lot of people sit down on their chairs from morning till night. All of these things, even when it even comes to general body health, how we take care of our health. How often do we do checkups just to check ourselves? A lot of these diseases we can actually check on them from time to time to see how predisposed we are to them. And most of these diseases, once they are arrested on time, we're able to better manage them. So yeah, I like this picture that you're showing. Hepatitis A, B, C, D. So these are the different types of hepatitis that can affect humans.
And then let's speak to them as we look at them individually. You had set the background. Hepatitis A could be
Yeah,
gotten through contaminated food and water. In terms of
yeah.
prevention, how do we prevent this? Do we not share eating equipment with those who have tested positive for hepatitis A? How do we prevent it?
So like we said, like I said, it's for hepatitis A. The prevention is very environmental most times, because it is important that good sanitation, use of clean water, sewage. Because I said earlier that it can be spread through the fecal oral route. That's what you take into your mouth. You get, so how we eat. That's why hand washing is important. Good sanitation, use of clean water, safe sewage disposal, even the toilets, make sure they are clean. Then hand hygiene cannot be overemphasized. COVID taught us how important it is to wash our hands, and this is also important when it comes to hepatitis A too. Then safe food practices too. If you buy food from the market, whether vegetables, fruits, important to wash them properly. Cook food thoroughly. When you buy food, meats, whatever it is, make sure it is well cooked. Then, interestingly too, there are vaccines available for hepatitis A too. So when the vaccination is done, you should also make avail yourself to be able to take the vaccines. Then community hygiene
No,
too.
hold on. Before we get into community hygiene, let's talk about the vaccines. Where
Yeah.
can people get them? Do they come at a price? Is there a round or a cycle of vaccinations? At what age are people supposed to take these vaccines? Could you give us some of those details?
Okay, can you hear me? Hello?
Yes, please. I can hear you.
Okay, so it is actually we have it is called the Hep A or hepatitis A vaccine, and it helps us. Okay, so we have two doses. You understand? So you have the first dose at any time. Then the second dose can be taken six to eight 6 to 12 months after the first dose, and then children as age one can take it. Travelers, people who are traveling to countries where they have hepatitis A high prevalence too, can also take it. People with chronic liver diseases can also take it. You get, so just people that are high risk, and even food handlers sometimes too, because we know that these are high risk people, and from how they handle food, it's very easy for them to also put it in the food that they give to other people. So yeah, it is 95% effective after the first dose, and after the second dose, it almost like give confers almost 100% protection. And if you take it, it can last for as high as 20 years. before you have to maybe take another one. So yeah.
Quite interesting. And now you're coming to community practice. You had talked about
Yeah.
vaccine. The next point you were going to
Yeah.
touch on was community. Let's pick up from there.
Okay, yeah. So I was going to say that it is important to maintain clean environment. Around us, if we there are a lot of things that we do that predispose us to diseases. You get so it's important that we are the champions of our own health, and it starts with the environment. Make sure you have a clean environment, and it's not just environment of your own house alone. Around you, encourage you and your neighbors to have a sanitation day where you get to clean the gutters, where you get to clean around you, cut bushes, on trees that have stayed for a long time. Basically just make sure that your environment is clean, because when you maintain clean environments in schools, markets, and even in food preparation areas, at the end of the day, it helps to prevent these things. That's why sometimes if you go to a place where you want to buy food and you notice the hygiene and that place, you can speak to them and let them know that they need to improve their hygiene. And it won't be out of place too if you don't eat from a place where you're not comfortable because you see that the hygiene is not top notch. So yeah.
Now, let's talk about another important part, especially for Hep B, which
Yeah.
is usually also contacted through unsafe sex.
Yeah.
It's also of the opinion that people, just by kissing someone who has Hep B, you can also contact it. How much of an awareness and a preventive strategy can people take in making sure that they do not contract it through such transmission mode?
Okay. So first is that protected sex is very important. So it is important to protect ourselves against things that are sexually transmitted. So whether it is Hep B or not, but most importantly, using condoms cannot be overemphasized when it comes to sexually transmitted diseases like Hep B. So make sure that whoever it is that you're having sex with, irrespective of whether you know their status or not, because at the end of the day, we're not just talking about HIV now, we're talking about Hep B. So even if you know if the person is HIV negative, do you know if the person is Hep B negative? So it is important to make sure that we use condoms, because condoms protect. They don't just protect against HIV alone. They protect against other things that are sexually transmitted, because it is a barrier method. So you don't get to exchange fluids with the person during that process. You get so that in case you have a cut or something during that process, it doesn't get to the point where you get whatever it is that they have. Then even blood transfusions too, and it is important to, if you go to a hospital and you are told to be given blood transfusion, it's important to ask, has this blood been screened? You get even needles when you are in hospital and someone wants to give you an injection. Is the needle a new one? Did the person just tear it? All of these are very, very important. So yeah.
Now let's talk about some of these symptoms. Are there
Okay.
symptoms to look out for if you're preventing as an individual that would inform you to go get tested? Because we know in Nigeria there's this self-prescription tendencies. What symptoms should inform individuals to, beyond self-prescription, go to test for hepatitis?
So hello, can you hear me?
Yes, please,
Network.
carry on.
Please, could you come again with that? Hello, could you come again
My,
with
my
that
question
question?
was on symptoms. If individuals are presenting certain symptoms, what symptoms are for that might likely be hepatitis, and how urgent should they present themselves for testing?
Okay, so if we're talking about symptoms, we're talking about symptoms for hepatitis B, right?
Yes, please.
Okay, so yeah, so the symptoms are, most times they appear. Most diseases have like an incubation period, a time when it takes for that, from when you're exposed to the viral agents to when the symptoms starts showing. So during that period, like between 1 to 4 months after exposure, you might have things like fatigue, fever, loss of appetite, like all viral diseases you get. So, high fever, nausea, vomiting, abdominal pain, especially close to that the liver area you get. So, that's the upper right side of the stomach. You feel abdominal pain. Then urine is a very big indication of hepatitis B. So if you have dark urine, or pale or clay colored, like pale colored stool, You get, then you start having noticing things like joint pain, muscle pain, jaundice, that's yellowing of the skin on the eyes, then you know that this is indicative of hepatitis B. So that is for acute short term infections. But for people who have had it long term, it can even lead to things like liver damage, liver cancer, swelling of the legs or the abdomen, and even some people also have experienced some form of unexplained weight loss too. So yeah, that's it.
Now, talking about cure, is there a cure for hepatitis? Is it permanent? What's the hope for someone who contracts hepatitis?
Hello.
Can you get me? I was asking about cure. Is there a cure for it? Is the cure permanent, or is it just treatment and you manage it like some other health condition? Hello, can you
Hello.
hear me?
Hello. Can you hear me?
I can hear you, but can you hear me?
Yeah, I can hear you now. Please go ahead.
My question is on cure. Is there a cure for hepatitis, or do you have to take treatment and manage it throughout a lifetime?
Well, there's really no cure for hepatitis, but since it's a viral infection, and it is important that it is managed so it can be controlled and managed effectively. You can That's why it's important to, even before it gets to the point where you even have to cure it. It's important to do regular checks. Liver scans, blood tests. Like this, there's a one called the liver function test that a lot of people might be aware of. So it's important to do that. But then again, if it gets to the point where the person is having liver failure or even gets to liver cancer, most people have to even do a total liver transplant. But for now, they are just drugs, antiviral medications that can help suppress the virus and prevent liver damage for now. But and these ones are taking long term. Sometimes people take them for life. So yeah.
Now, let's talk lifestyle choices. How
Yeah.
can persons guard against hepatitis through some certain lifestyle choices? What are some of
Okay.
those choices that would ensure better liver health?
Okay, yes, we have mentioned some of them already. First off is like we said, conditions that predispose people to diseases, to this form of diseases, things like alcohol abuse. You want to make sure that you want to be careful about how much alcohol you take, so that it doesn't get to the point where if you now have such viral infections, it now gets to a very severe point. Then also, like we have mentioned, protected sex, very important not to take sex unseriously. Very important to make sure that you use condoms, because the condoms are the only way that you get to prevent the exchange of fluids during sexual intercourse, and that it does not just prevent against HIV as we know it, but it also prevents against the sexually transmitted types of hepatitis. And then we have also mentioned environmental health, making sure that we keep our environments clean, especially for things like hepatitis A that can be transmitted through the fecal oral route.
Well, thank you very much for taking our time to join us on the program this morning to discuss hepatitis in you. We appreciate you for shedding light on the disease and also encouraging our viewers on ways to better guard against predisposing themselves to a risk of contacting the virus. Thank you.
Thank you very much. Thanks for having me.
You're welcome.